Hello, and welcome to this week's episode of GIANT's Healthy Innovators Live TV. My name is Barry Shrier. I'm the founder of GIANT Health, and I'm really happy to be welcoming all of our listeners from around the world. GIANT Health is a global community of nearly 200,000 people, everybody around the world whose business is healthcare, tech, and innovation. Every week, we're very, very proud to bring to you amazing, dynamic, and incredibly interesting and successful entrepreneurs who are at the cutting edge of creating new healthcare solutions, new technology innovations, and new advances in healthcare to deliver better healthcare outcomes at lower cost. So before we begin, I just wanted to say thank you to our sponsors. Thank you to Vodafone Business. Thank you to Barclays Bank International. And thank you to our knowledge partner, McKinsey & Co. We love working with our sponsors. We're grateful for your support and really hope to continue working with you for many years in the future. I'd also like to remind all of our listeners, you've probably never heard me say this before, but we encourage you to like this episode and to subscribe to our YouTube channel. What we're trying to do, of course, is to serve our global community by creating the largest field of support that we possibly can with these TV episodes, with our weekly email newsletter, the podcasts that we do, our annual events. So if everybody can subscribe and like these YouTube channel programs, that would help, and we'd love to support all of you as much as possible. Lastly, don't forget to go to the GIANT website, www.giant.health. We have our big annual event coming up on the 30th of November, 1st of December. That's in London, England. According to the Financial Times newspaper, it's Europe's largest, most valuable annual healthcare tech event. So hope to see you guys there. Anyhow, today we have Mike from Blum Health and Edward from LYFE. Hello, Mike. How are you?
I'm well, thanks, Barry. And you?
Yeah, doing really well. Thank you. And hi, Ed. Thanks for joining us.
Hi, morning, Barry. You right?
Yeah, doing very, very well. Thank you. So we're talking about big issues in healthcare. So, Mike, what's an example of a big challenge in healthcare or a big issue in society that we can address with innovation and that needs healthcare solutions, new technologies?
I think the most obvious and the most sort of pressing at the moment is the COVID backlog. So, obviously we're all familiar with what's happened over the last 18 months. I won't dwell on that too much longer. But actually, the consequences of that are now starting to show.
Yes.
In terms of the backlog of elective procedures and things like that, we're now starting to see the repercussions of that. So delays in procedures and delays in treatment as a consequence of that.
Yes,
And really,
absolutely.
I think that is one of the biggest targets for innovation and biggest targets for quality improvement. It's something that we've been watching at Bloom Health since really COVID started, and we've tried to be as proactive as we possibly can in supporting that.
Yes.
Creating software as a service, creating software that literally just supports the human resource within NHS trusts is something that we've been trying to do for really since COVID started. And I think that, as you can see from the various grant applications and the government announcement, there's a big push for this NHS reset and recover. So actually, now that we are in this post-COVID world almost,
Yes.
actually, how do we improve those processes? How do we make them more efficient? And how do we adopt technical innovation and other innovations to actually support our workforce to deliver this service with the current issues that we have?
Absolutely. Yeah, no, Mike, thank you very much. That's a huge issue for the UK, but also for every country around the world. So thanks for raising that subject. And obviously, very cool what you guys are doing in the area with Bloom Health, and very keen to learn more about that in today's episode. Thanks for that introduction. And likewise, Ed, we're talking about big challenges in society. What are some of the needs that relate to healthcare? And also love to hear what your views are on that and what you guys are involved in.
Yeah, so building on what Mike said, it's a great point, and I think half the issue is that here in the UK we have a healthcare system where we're quite dependent on GPs.
Yes.
And so GPs are primary care, so they're basically your first point of access. I'm not too sure how it works around the globe, but that for us is the way things. We triage our patients through that, if you like,
Yes.
through the community. And the issue is that through COVID, the COVID measures are still in place. So we're not doing that many face-to-face appointments.
Okay.
And patients can't get appointments. So we're seeing a huge backlog in A&Es. So that, A&E secondary care, it's the frontline works, if you like. And yeah, we're just hitting so many problems with that. There's backlogs with absolutely everything. So there's no medical beds, there's no surgical beds, there's no mental health beds. And it's like, well, we're pushing more and more people into the system and there's nowhere for people to go.
Yes.
So we're in the position where it's like, what's the way out of this? So for me, funnily enough, I was on a call last week now with the mayor of Liverpool.
Oh,
And a board of people who are trying to solve the problem in the northwest of England. So I'm up in Liverpool. For
okay.
the worldwide listeners, that's where the Beatles are from, and
Okay.
the best football team in the world, Liverpool. So I was on a call last week with the mayor, and we posed the question to him: is what's the way out of this? Do you think that we need more funding in secondary care and primary care places where we can hopefully deal with the backlogs, or do you think a change of philosophy is required where we are treating people in new, innovative ways? And I guess that's where we come in as LYFE. That's LYFE with a Y, where we're teaching people how to live a more healthy lifestyle day to day.
Right.
So we're leaning on people's preventative health. We're teaching people how to optimize their health moving forwards. And hopefully with that change of philosophy, we're stopping people going to the GPs as often. It's simple things like watching what you eat and exercising appropriately and building relationships with people that are meaningful and harboring enough intrinsic motivation to go out there and make your life as good as it can be. It's like, it's not necessarily rocket science, but actually it's quite hard to do over a sustained period of time.
Yes.
So
That's a very, very good point. This incredibly important subject comes up all the time, which is that, number one, of course, the direction that society is going, we don't have unlimited financial resources to deliver unlimited growth in demand for healthcare services. And we have basic things like aging and new chronic diseases, diabetes and so forth, causing more demand. And therefore, we have to move towards citizens looking after their own health and taking responsibility. So it's very interesting to hear that because, of course, Michael, at one end of the spectrum, we have people that have been waiting for elective surgery for a long time, and the delays are growing because of the pandemic, aren't they? And at the opposite end of the spectrum, we have the requirement to say to everybody, look, you all have to pull your socks up and take responsibility for your health and maybe move a little bit more every day and maybe eat a little bit less every day and all those good things, which of course I never subscribe to, but I heard that they're good things to do. And so this is extremely interesting because technology can play valid roles in across the whole spectrum, can't it? And so on that theme, Mike, tell us a little bit more about what you guys are doing. And does it relate directly to what you were talking about before? For example, do you guys have new services that relate to helping the healthcare system manage with electives and the big backlog?
Yeah, so that's one of our main focuses at the moment, Barry. We have got our finger in a few pies, but that right now we're looking at actually supporting that backlog. So I think it's quite interesting what Ed was saying, because I think our companies complement one another quite well. Ed's taken a very proactive approach, trying to, providing that preventative medicine, stopping people from turning up at the front door, and actually we are quite reactive in our nature. So, if there's a problem, we'll try and innovate. We'll be quite disruptive in our innovation. So try something quite novel and weird and wacky, in the hope that actually it does prevent some of these resource burdens and, actually create efficiencies that, in any way possible, really. So I think that was quite a nice sort of way to look at that.
Yes.
But going back to your question, so I think when we started to notice the backlog. So, for example, specifically endoscopy is an area that we've seen be hit quite badly by the pandemic.
Right.
At one point in time, capacity or activity was reduced down to 5% of its normal activity.
Oh my God.
So if you think about the bowel cancer screening program is reliant on endoscopy. And therefore, reducing down the amount of endoscopies happening per annum can have quite significant consequences to a large population.
Absolutely.
And obviously, bowel cancer is one of the most sinister cancers, and so therefore, it's about taking ownership over a problem and thinking of a solution. So what we did in the endoscopy space is we said, look, there's about 15 to 20 manual steps happening at the moment, from triage to booking to receiving bowel preparation kit at home, and then to receiving a leaflet. Now,
Yes.
we said, well, we can innovate at any point in time through that journey. In fact, we can innovate through all of those processes, because there's organizations that have created e-leafleting. There's organizations, no doubt, that have endoscopy booking systems or booking systems in general. But
Yes.
actually, when we'd spoken to key decision makers and influential people within the endoscopy space, they'd heard it time and time again. People were only solving one problem. So we said, let's create an end-to-end solution in the endoscopy space.
Yeah.
And if we can do that, then we can do it the same in physiotherapy or dietetics, really not trying to create anything fancy. There's no artificial intelligence involved. There's no virtual reality. It is literally supporting staff take a patient through that pathway.
Yes.
And we were finding that there were some trusts that were paying band 5 nurses, 3 band 5 nurses, just to triage endoscopy patients. And we said, well, why are we not giving the patient a smart form that they can actually fill in themselves? And then the nurse can call them if they find anything that might be abnormal. Exactly. It's little quick wins like that. I mean, when I say little quick wins, technically they are quite big. There's a lot of software design and development needs to go in, regulation, getting it into an NHS trust. We can talk for hours about how difficult that is. But actually, from a value proposition perspective, the evidence is clear that actually utilizing software to support our workforces, particularly when there is a lack of resource, nursing resource, and there was massive gaps found during the COVID pandemic. They were probably always there. They were only amplified by the COVID pandemic. So it's really about, we're not looking to replace people. We can't replace people. We need healthcare professionals. It's about how do we make their lives easier so that they can see more people or, have more time to actually complete their normal duties. So we're looking at focusing on the endoscopy space to do that.
Yes.
And that's an
really cool. And it's such a good example where it's not that complicated. I mean, it is complicated, but the bits of it aren't that complicated, like you said. And there are opportunities immediately, from what I understand of what you're saying, to gain immediate, meaningful benefits if all these things are stitched correctly, successfully, and implemented. So thanks, Mike. It's a great example. But how about with you, Ed? Do you find that there are similarities here regarding, well, you talked about, different aspects of people's lifestyle, and maybe people know about, what do you want to call it, little fragments of these things, but there is an opportunity to bring it all together. Is that a key element of your platform?
Yeah, for sure. I think this is generally the problem with many healthcare systems, is that everything is fragmented. And to actually get something which is integrated is very difficult. And, to actually get a piece of tech into the NHS, it's very, very difficult. Their procurement processes are huge. And you know what physicians are like as well? They're so set in their ways. Sometimes it's, that they're slow to uptake new technologies, which is, presents lots of challenges. But actually, as Mike's highlighted, there's so many inefficiencies in the system that can be solved not through complex measures, but by looking at the problem and coming up with a rational solution to it. So it's actually, it's actually a more simple job than you might think, but the system certainly doesn't help. And, that's something that we've recognized. So our app essentially is around looking after your mental health and your well-being. And to do that, there's 8 key areas. If we look at the literature, there's 8 key areas. And that's why our logo is an octagon. So everything within the LYFE app sits around the 8 core life elements, we call them. Now we put our healthy partners into those 8 key areas, and you engage with them all in one space. So I think that's really our USP, is that everything's all in a singular domain for you to engage with. So prior to the LYFE app, before I started using it myself, I had downloaded 27 apps onto my phone.
Wow.
To book fitness classes, to track calories, to track my mental health, to relax with Calm or Headspace. And when you add them all up, I had 27 apps.
Oh my God.
It's like, that is so inconvenient that people just can't be bothered doing it. So, yeah.
No, that's extremely interesting. I'm just making a note. This is a good excuse for me not having a healthy lifestyle. I could say, oh, there's just too many apps out there, and I don't have time to use all those apps. If only it was all consolidated into one platform.
Yeah, well, it's an important issue, isn't it? Because the average user downloads 0 apps per month. So this is another issue for the NHS
That's a
where,
good point.
you know, they look at all of the different issues. So Mike's highlighted endoscopy, but you know, you see this across every single referral pathway within the NHS. It's so specific, and even within a singular trust within the NHS, each speciality, so let's say gastroenterology or respiratory medicine or neuroendocrine medicine, those teams have picked their own different pathways, and they'll have their own different apps to
Right.
engage with their patients. So
Yes,
it's like within the same trust, there could be hundreds of apps.
that's extraordinary. Yeah.
And then trust on trust, and then across the nation, it's just like, well, something's got to be done, you know.
Yes, well, no doubt about it. It's kind of paradoxical, isn't it, that that technology adds complexity, but what is also simultaneously required is simplicity. But very interesting. You know, one of the things our listeners love to hear about is people's journeys and their careers. And what's that famous joke? Well, if you wanted to get to where you are today, you wouldn't start from where you started, or whatever it is. But people do love to hear about this, because obviously this gives a lot of our listeners who are themselves entrepreneurs and people that are facing similar challenges with tech and innovation and implementation and procurement, valuable input. So if it's okay, love to hear from you guys about that as well. So Mike, did you start off as an entrepreneur? Were you dreaming at age 8 of launching Blum, or how did you get to where you are today?
Absolutely not. I mean, my journey was quite, you know, I think I always thought that I wanted to be a doctor. So I you know, I started out thinking, you know, at A level, I was good at maths and science, and I thought, well, I can't think of what to do in maths, so I'm going to do science and become a doctor. So I
Yes.
actually didn't get into med school first time round. So I went and did biomedical science, the textbook transition, and
Nice.
and started to do that. And those 3 years, they were great fun. Shout out to the University of Lincoln. But actually, it was really a sort of a moment in time where I really didn't know what I wanted to do. And you know, I still didn't know by year 3, so I thought, well, I'm going to give medicine another shot, and that's when I went to the University of Liverpool.
Oh,
And
okay.
it wasn't until I started to go to the University of Liverpool, I was, you know, trying to find all kinds of weird and wacky ways to support myself financially. I was doing tie-dye T-shirts and selling them on and all that kind of stuff way
Brilliant.
before Etsy was around. And
Yeah.
so I guess I fancied myself as a bit of an entrepreneur, but never thought I would get there. And then when people started to talk about, you know, as a medical student, you spend a lot of time studying corridors, and you start to hear people complaining about, this is staff complaining about inefficiencies, complaining about resource gaps, and, you know, rota
Sure.
gaps and all that kind of stuff. And you start to think something's got to give, you know, something's got to change. And at the same time, you've got healthcare professionals, and I'm sure Ed can vouch for this as well, healthcare professionals saying, God, this job is really hard. Like, you know, stop while you're ahead and get out of med school. And I was like, damn, really? I've put all of this energy into this, and people
Yes.
telling me this. And it was quite distressing, I must admit.
No.
But nevertheless, I persevered and carried on through. But it wasn't until sort of middle of med school that I started to go to innovation and startup schools and sort of hackathons and things like that. And I thought, this is what I want to do. You know, it's all well and good helping patient by patient, but actually you can help thousands, hundreds of thousands of patients through just changing one thing in a system. And I thought that for me is where impact sits. And, you know, we can still leverage our skills. You know, Ed and I are both physicians, so we can still leverage our clinical knowledge, but actually leverage it in a way that has a wider impact and a
Yes.
greater value proposition than actually seeing 8 people in an 8-hour A&E shift. I don't know whether that's too many. I can't remember how many I used to see, but yeah. So you know, that's where I came from, was very much a case of a problem solving. And you know, being a doctor, you are a problem solver. So I guess in those aspects, I was always an innovator, always a problem solver. But
Yes.
it wasn't until I saw the opportunities to make a difference and improve things that I really realized that was what I wanted to do. So I took the plunge a few years into being a doctor,
Right.
and now a lot of my work goes into building software for bricks and mortar businesses, as we like to call them, clicks and mortar businesses.
Exactly. Yeah.
To
Yeah.
turn them into something that is, much more efficient,
Yes.
much more cost effective, but actually has the patient at the center, and still provides them the care that they deserve.
Yes, yes, exactly. And that's absolutely crucial. So thank you for sharing, Mike. Really, really interesting story. But what you just said, which I think, of course, is clearly a manifestation of your medical education and your experience as a physician, that theme of putting the patient at the center, where sometimes there's the risk that technology doesn't do that, and that systems, as they expand and become very large and self-sustaining and ingrained and bureaucratic, don't necessarily have a tendency to put patients in the center. So good to hear that coming up as well, and to make sure that that's part of your perspective. But
Absolutely.
yeah, no, likewise, Ed. How about yourself? How did you get to where you are today?
I think similar to Mike, to be honest. I didn't at any point think I'd be either a doctor or an entrepreneur, to be honest. I was a bit of a clown at school.
Oh, okay.
When I was about 8, I started selling things at school. I was selling. We had these refresher bars in England, about so big, a bit like a Mawam. If you've heard of Mawams, I just stuffed a load of those in my bag after going to Costco, one of the wholesalers, and I guess that was my first entrepreneurial business. Got a few detentions, but it's made a bit of pocket money. So
Perfect.
and then, similar to Mike, I was at school. I didn't really know what I wanted to do, but I knew science was my kind of thing. It was my forte. So
Nice.
I thought, well, I'll be a doctor then. So I started med school, and
Yep.
I guess the real underpinnings of life came from med school. I was kicked out of university 4 years ago. I was kicked out of university. Erroneously, it was wrong, but at the time, everything I understood about my life and where things were going was kind of thrown up into the air. So, it was my penultimate year. I'd finished all of my exams, and I was in Mongolia at the time, completing another part of the course. And I got an email saying, "You've been removed from university because you failed one of the exams." So I was like,
Oh my gosh.
right, what the hell do I do about this? So, during that period, I was out of university for about 8 months, 9 months, and the impact on my mental health was, somewhat significant. The trajectory of my life had been thrown up in the air. So it's kind of like
Sure.
everything you understand about yourself is just gone in an instant. So at that time, I went away and I started looking at how I could actually look after myself and how could I try and piece my life back together. And I think the amount of help out there was sparse and it was a bit crap,
Yes.
to be
Yes.
honest. I wasn't suicidal. I wasn't at the point where I was going to jump off a cliff where I could, and at that point I could get help. But prior to that, if I just wanted a bit of direction, if I wanted to know how to get my life back in order,
Right.
how to get some motivation, nobody wanted to know. So it's kind of like that was the first thing. I was like, why has no one done something about this?
Yeah.
So many other
Interesting.
people must be having problems.
Absolutely.
And then one of my friends from school, he ended up killing himself during that time period. So I was just like, right, I've got to try and do something. So
Yes.
I just reached out to a couple of schools in Liverpool and started doing so at this point I was back into university. I was almost qualified as a doctor, and
Okay.
I got a big apology from university. I represented myself at court. It was all very bizarre.
Oh
um,
dear.
but yeah, just started lecturing school kids at school and just teaching them about we all have struggles. Life's generally quite crap, and it's normal to feel bad. Negative emotion's not a bad thing. It's
Yes.
as human beings, we're more tilted towards negative emotion than we are positive emotion because hang on, we've gone off. I think that's why we're much more likely to be upset if someone takes £5 off us than we are to gain £5. We're much more tilted towards negative emotion,
Absolutely.
and that's normal. So just started teaching the kids about this kind of stuff, and it snowballed massively. So I thought, make a business out of this.
Yes.
So it's been rolled off into businesses, and it was taking up a lot of time, and working full time as a doctor as well. It was like, how do we scale this? So got a little team together and tried to distill that same ethos down into an app. So
Yes.
that's where LYFE came from.
Nice. Excellent. I mean, it's not surprising, but it's so attractive and impactful that you guys have had these personal journeys, which have of course, led you guys to have the drive and the ambition and to perceive the needs that are really there, rather than engineers, for example, inventing technical solutions which don't necessarily even serve the real needs of people or serve the real requirements, for example, of a hospital department or that type of thing. So thanks again, obviously, Mike, and thanks, Ed, for sharing that, because I think this is a recurring theme, but it's a good recurring theme, and it's an informative recurring theme, and glad to hear your stories as well. So I appreciate you sharing that with us. Thank you. Unfortunately, I wish we were in a pub garden right now, and I could buy around and we could just keep talking about these interesting and valuable subjects which are important in society for the next hour or two, but we're going to have to wrap up in a few minutes. I hope that's okay with you guys. So what's the future look like for you? So, where are your businesses going? Where do you see yourself in the next 5 years, for example? And what are some of the challenges that you're facing with your business, which you'll be addressing to get to that destination 5 years from now? So we've been going back and forth, but how about, Ed, if you let us know this time to begin with, like I said, what are some views of yours about the future? Where will you guys be 5 years from now? What are some of your big challenges right now, which you're tackling to get there?
Yeah, so I mean, at the moment, I've split my time between A&E, intensive care, and the business LYFE.
Yeah.
For those American listeners, A&E is the emergency room, or ER, as you guys say.
ER.
ER. So I think I would like to spend a bit more time on the business, and my life's certainly more down that route now. So I'm locuming, so it's only part time in A&E and intensive
Okay.
care. I think challenges for me is personally trying to balance everything is difficult. So I'm
Sure.
moving down in a field called lifestyle medicine. So I'm currently studying a diploma in lifestyle medicine, and in the next 3 to 4 years, I want to be the most qualified lifestyle medic in the world. And I've done the American exams. I'm doing the British exams now,
Nice.
and there's European exams coming up. So I'll have done the whole globe's worth, if you like. But trying to balance that with scaling a startup and working in A&E is somewhat difficult.
Of course.
But yeah, I think that's the next 3 to 4 years that should be boxed, and hopefully, as Mike said, these things are scalable. So hopefully, you can start having an impact on a much larger scale, and
Exactly.
you're not seeing a patient an hour, which actually is quite good. If you're getting through a patient an hour in A&E, you're doing quite well,
Yes.
because there's a lot of crap that comes with that. But yeah, I think the business it's ticking along quite nicely. We've created a healthy community up in the northwest of England, and the plan is to get further investment and to scale more rapidly across the country.
Nice.
So we've had a lot of technical issues with it, but now we've got our own in-house tech development team.
Oh,
So
cool.
the way that we're building the tech is much quicker. It's based on the feedback from the users, and it's just a much better way to work.
Superb.
We were previously agency, so
Yes.
that's where we are, Barry.
Nice one. Well, very interesting. And obviously, we wish you the very, very best of luck. And maybe I should ask you for your signature now, but before you become the world's most famous lifestyle medic.
That was perhaps too far, but
Yeah.
you know where I'm going.
Yeah, of course. No, of course, but very interesting, and we're keen to support you. As you know, Giant Health is a global community.
Yeah,
Our
thanks,
ambition
Barry.
is to help you guys, to support you, to ensure your own success. So very
Thank you.
keen, and we were talking about that earlier, hoping you'll be able to exhibit at the Giant Health event at the end of November in London.
In London, yeah, absolutely. We're very keen.
Brilliant. And likewise, obviously, Mike, similarly, keen to hear about what your views are of the next 5 years. What are some big challenges for the business, and how are you going about tackling those?
So yeah, I mean, similarly to Ed, I think it was. I mean, I'm probably taking a bit more of a transition to sort of leadership and management.
Right.
I'm almost exclusively working with Bloom now. I do the occasional clinical shift, just to keep my knowledge there, because I think it's important, and obviously still, always keeping an eye out for, gaps where support is needed. But
Yes.
I'm also doing an MBA, so at the moment,
Nice.
so certainly in the next year or two, I'll need to make a big decision about, do I take that leap of faith into management. But I'm really enjoying this hybrid approach at the moment. I think Bloom is going to be requiring more and more of my time.
Yes.
We will continue to support NHS trusts and private institutions to provide impactful software solutions. Whether that be something that we innovate ourselves, or collaboration was always part of our strategy for this year. So actually finding a few organizations that had really great ideas and coming up with flexible solutions to work with them, and flexible agreements to work with them, and we hope to always be able to offer that. There does come a point where you hit a ceiling of resource as an organization, and it's important to notice when you're about to hit that. But we're always open to hearing about people's ideas. We give feedback. If we really love it, we'll support, and that's always something that we want to do till the end. And yeah, the enabling side of things, we hope to continue to do that. We provided a small amount of pro bono support at the start of the year with the NHS England Clinical Entrepreneur Program,
Nice.
to get to design some solutions for thinkers and innovators, and actually one of them we progressed to MVP, which is really exciting. So
Wow. Well done.
we don't fancy ourselves as agency, we fancy ourselves as part of the team, and I think that's really important, because it keeps us excited, it keeps us
Yes.
seeing the solution through. So our collaboration is really exciting. But I think for us, next steps are internationalization. We certainly want to be able to utilize some of the great tech that we've built over the last 18 months in other countries. There's further inequalities and things like that in other countries. So we do need to tackle that, but we hope to always be able to continue to support on our doorstep, provide value to the NHS, and continue to innovate for them as well.
Excellent. Oh, good stuff. And I mean, it sounds like you have a few things on your plate, but good luck with all of them. And it's very exciting to hear how both of your businesses are developing. And naturally, like I said before, we're very keen to support you guys, and certainly ambitious to make sure that all of our listeners are aware of what you guys are doing, and whether or not there are people in the global Giant Health community that can help and support you guys. So we're going to wrap up now, but one final little question, which is, do you guys have any asks of the community? Are you in fundraising mode? Are you looking to recruit? Do you have some collaboration partner or supplier that you're trying to find these days? So if you have anything in particular which might resonate with our community, we're always keen to have you guys share your asks, so to speak, with the Giant Health group around the world. So on that note, Ed, are you guys looking to raise money? Are you looking to recruit, or anything in particular that maybe people in our community can support you with?
Yeah, all of the above, Barry.
Yeah.
We're looking at, so SEIS and EIS accredited. So we are looking to get a mixture of both of those investments. So
Nice.
there's some tax relief there for those of you who are tax savvy.
So you're looking for private equity angel investors?
Yeah, most likely. I think we've had a lot of grant funding so far, which has been good. We've never written bids before, but we thought, let's give that a go.
Sure.
And we got it, thankfully. So we managed to hold on to all of the equity of the company, which is great.
Excellent.
But yeah, we're fundraising, and also there's a couple of positions open around marketing. So we need a junior marketer, and we need someone to take over and manage the little team that we've got. So yeah.
Excellent. Oh, no, good stuff. Well, look, we'll make sure that the links to your business are at the bottom of the YouTube channel, and very keen for all of our listeners to engage with you. So, Ed, what's your website address?
So we have a couple. The one that you should look at the moment is called The LYFE Club. So LYFE is spelled with a Y. TheLYFEClub.co.uk.
Perfect.
We have a new website which is coming out, but it's not quite finished yet. That is
Okay.
called.
We'll stick with the LYFE Club.
Okay, let's do that.
Yep. Perfect. And likewise, Mike, do you have any asks? You guys in fundraising mode or recruiting? I'm not sure if I have enough time to work for both of you, so maybe I could do part-time for the two businesses.
You're always welcome, Barry. Yeah, so we are raising funds for the endoscopy solution that I was mentioning earlier. So
cool.
absolutely, we're looking for scale-up funding. So it will be private equity and angel investment or match funding for grants should be successful. Yeah, absolutely. We're always open to those conversations. Recruitment is something that we welcome with open arms. You know, we've got interns, even though we recognize we're still a small company. So regardless of experience, you know, we try to support, teach and educate. So if there are people that are interested either in clinical innovation or software engineers that are interested in health technology specifically, or, you know, health or software engineers that are just, you know, looking for work and support them, we're always interested in collaborating, meeting and discussing how we can work together. Yeah, and I think that is really where we're at. We've a lot of well, some of our collaborators would probably welcome some financial support as well. So I think, you know, the main thing is please reach out to us if you have any ideas or you want to just run some ideas by me. I'm more than happy to say, you know, this could work or this won't work, or regulatory stuff, you know, that kind of thing. So I'm often used as a sort of sounding board for ideas and say, you know, this is really good, but and so, you know, we like to think we have a very much an open door policy for you know, both in-house and for our clients and people that are interested in what we do. So yeah, absolutely.
Nice. Cool. Oh, Mike, thank you very much for that. Really appreciate it. And once again, for our listeners,
I was just going to say our website's Bloom Health, again spelt wrong, so it's BLUM. So both of our names are spelled differently to what you'd expect.
Mike,
so
that's
Bloom,
tech, mate. That's tech.
Yeah, that's it. It's cool. It's cool. It's 2021. So it's bloomhealth.co.uk. Thank you.
Clearly, it's not a requirement to become a qualified doctor to be able to spell, but that doesn't seem to matter. So it was a great pleasure to have you guys on today's episode. Thank you very much. Honestly, really, really appreciate your time. I know you guys are busy and you're actually doing important stuff, and we're proud of the accomplishments that you guys have shared with us. So thank you, obviously, Ed. Thank you, Mike. Really, really appreciate it. And looking forward to seeing you both at the GIANT Health event in London on the 30th of November.
Absolutely.
So thank you.
Thank you, Barry. Thanks for your time.
Thanks, Barry.
Once again, we'd like to thank our sponsors. Thank you to Vodafone Business. Thanks to Barclays Bank International. And thank you to our knowledge partner, McKinsey. We love working with our sponsors. We have a lot more sponsors that you can see on our website. The website address is www.giant.health. And we'd like to invite all of our listeners to come and see us either in person on the 30th of November, 1st of December at the GIANT Health event, which is in London at the Business Design Center. And the entire event will be mirrored virtually. So it's a hybrid event. Anybody can participate anywhere from around the world remotely. You can see all the speakers live on stage, remotely on your laptop. You can engage with all of our exhibitors and sponsors and do all the networking from your laptop on our virtual event platform. So once again, we would love to encourage everybody to join us. The website is www.giant.health, and looking forward to engaging with all of you on the 30th of November, 1st of December. So thanks, everybody. Nice to see you, Mike. Nice to see you, Ed, and looking forward to seeing you guys in the near future. Thanks very much. My name is Barry Shrier. This is this week's episode of GIANT's Healthy Innovators TV.
Thank you.